NCCM for having me here today to share a topic about soya and breast cancer. My name is Sik Yao. I am a nutritionist from ACE Canning. Just a little bit background from where I'm from. Our company manufactures soya milk and Asian drinks. Brands such as, I can mention brands, right? Like Drink Whole, Home Soy, and you have a little pack of the sample in your bag today. So yeah, let me get this. Okay. Very briefly, these are the contents of my topic today. After an introduction, then we will straight ahead jump into the role of soya in breast cancer, and then we'll look at some of the evidence in risk reduction, and then also a little bit about the survival rates and recurrence, and then we'll end with key takeaways. I usually like to start my presentation with this slide when I talk about soya. We are very familiar with soya foods like tofu, soy milk, tempeh, soy sauce, doenjang, natto. But maybe the younger generation may not know what soya beans look like in its raw form. Can you tell which one is soya beans? I think most of us should be able to, right? Yeah, that's one. And it's in its fresher form that's on the little tree. On the plant itself, there's the edamame that we have in Japanese food. Right? It's very healthy. So very quick background of a history of soy, and we know that soya has been consumed since ancient China, like 3000 BC. That's like 5,000 years ago, and it's been, evidence shows that it's been domesticated since then. And moving forward, it's also been in Japan and Korea. You have tofu, you have soy sauce, doenjang, the soybean paste, and then over here in Southeast Asia, in Indonesia, we have tempeh. Very popular soya food in Indonesia, and it's very healthy as well. So, and of course in Southeast Asia, there are a lot of diversified into different culinary applications, and we have a lot of desserts made with soy. And then, since the 1990s, soy food had become a global phenomenon where it became more popular because it's known for its complete protein profile. It gives you very good source of protein. And then there's also tofu, soya milk, soya-based meat alternatives that are gaining popularity due to the plant-based diet trend, vegetarian and vegan trend, and of course, of the known nutritional benefits. Although I'm a nutritionist, I only have one slide about nutrition on soya today. Basically, just a very quick overview. That's the macronutrients, micronutrients, and the biochemical compounds, bioactive compounds of soya. So in terms of macronutrients, we know that soya provides you carbohydrates, protein, and fat. Those are the healthy fats, low in saturated fat, and good source of essential fatty acids. But one thing I would like to note here is the complete protein profile for soya. What I mean with complete protein, if you're not familiar, it means that it provides you with all the essential amino acids that we need. Soya is one of very few plant-based protein that is able to give you all the essential amino acids, meaning the amino acids are building blocks of protein. So when we consume food, the essential amino acids are what our body cannot make. So we must take it from food. Those are non-essential that our body can actually produce. So you don't need to, consume it, but your body can make. But most of the meat-based protein, like eggs, chicken, meat, or dairy milk, already will give you all the essential amino acids, the profile. However, for plant-based, soya is one of the very few. Another examples would be like quinoa and green pea that will have the complete protein. All right. And in terms of micronutrients, soya beans provide us with calcium, iron, and magnesium. An interesting part about the bioactive compounds, it gives you certain health, protective health benefits, but without it, your body can still function, no problem. But with these compounds, right, sometimes it helps to prevent certain diseases or promote health. For example, in soybeans, you have isoflavones, which I will narrate a little bit later, like phytosterols, that actually helps you to reduce your blood cholesterol. Of course, taken along with healthy diet and exercise. If you take soy alone and you're not practicing healthy lifestyle, it's not going to help you in any ways. Right? So, what is the role of soya in breast cancer? I think most of us here, would have, I'm sure you have read or seen or heard something about soya and breast cancer. whether it is protective or it is not protective. Okay, so today we'll go through some of the science. But before that, most of you here might have, if you do a quick search on Google or internet, you will see all these questions. Soy and breast cancer, is it safe to eat soy? Should I avoid soy if I have breast cancer? Would soy cause breast cancer? And if I've already, get out from breast cancer, I'm already cured, already remission, can I still consume soy? So with all this myth around, you'd be surprised that even some doctors or even nutritionists, they are not quite aware of the science. There was a research done about a few years back. It's a survey done through health professionals in Southeast Asian countries like Singapore and Malaysia. They actually interview medical professionals. You'd be surprised that more than half of them actually believe that soya causes harm and also with association with gout. But then those are actually all myths. But today we're going to talk only about breast cancer. Okay. What about the science? What does the science say? So those are the myths. How do we clear it up with science? Now there are numerous scientific studies showing the association of soya in breast cancer, whereby it helps to reduce the risk. Not in terms of prevention, because you're talking about prevention, eating soy alone is not going to help you prevent, but it reduces the risk. Studies have shown that, which I will share later. And also increasing survival rates, and also reducing recurrence cases. But why the misconception if science are already showing that? Just because in the earlier days, when they first started doing scientific studies on soya, they were using mice. So the results are very different when you do studies on human. Okay? So that could be one of the reasons why there were some studies that giving conflicting results. And also, some of the studies done in the earlier days are based on the Western population, the Caucasian, the Ang Mo. Ang Mo, that's the Caucasians, right? So,
I'm not Caucasian, don't you?
yeah, I'm just trying to explain Ang Mo. You may not know the term Ang Mo. So, yeah, you see, our genetic is very different. The way our body processes food or nutrients or bioactive compounds are very different among different populations. So that could be one of the reasons why there were conflicting studies results. And thirdly, in terms of in the eyes of the public, when they see the term phytoestrogen, I hope most of you have heard this term before, phytoestrogen. Do you know what it is? Oh, okay, good. Because I have one slide to clear about this, in case some of you may not is not familiar with this term phytoestrogen. What is phytoestrogen? Or isoflavones when you refer it in soya bean. What is the connection with estrogen? Because phytoestrogen, right? So I'm going to clear it up here. Estrogen is a hormone that our body produces in both men and women. Men has estrogen as well, but if a smaller amount, of course women we produce more estrogen hormone in our body. Okay? Whereas phytoestrogen, there's actually a plant-based estrogen. It's a naturally compound found in many plants. So, but it does share some similarities with our human estrogen, although it's not the same. Okay? And isoflavones, that comes from soy, it is a type of these plant-based estrogen that is natural from the plant itself. Okay? So when you consume isoflavones or the plant-based estrogen into our body, what it does is, it doesn't act exactly the same as our human estrogen, of the hormone or estrogen. It binds on to the receptor differently. So it works differently. Okay? And that is also one of the reasons that scientists concluded that, that's why soya helps in reducing the risk of breast cancer, because it kind of fight on with the receptors of the estrogen in the body. Okay? So the takeout is isoflavones or the phytoestrogen is not the same as our human estrogen hormone in the body. And by consuming isoflavones or the phytoestrogen, it will not turn into estrogen in the body. Okay? So now, there are numerous studies, like I mentioned. Soya has been studied extensively for the last more than 30 years, over 30 years. And we'll go through some of the studies and evidence on breast cancer risk reduction first. Okay? Some epidemiological studies. And most of these studies, numerous studies have consistently shown that soya isoflavones may help reduce risk of breast cancer. Also, when they look into all these studies, right, I just put a very simple conclusion here, is that when they look at the subjects, right, higher soya intake compared with those who are not eating as much, they actually have lower risk of developing breast cancer, right? And it's also more evident when the studies are conducted among Asian population, the Asian women, as compared to the Western or the Caucasian women. So like I mentioned just now, maybe because our body just do not process it the same way, or secondly, is about the amount that we used to take is not the same because we take soya in a much higher amount, or even, when do we start taking soya? Of course, in Asia, most of us have had at least tofu or soy milk since we were young, when we are just a little child, right? Whereas in the Western population, they're only introduced with soya food very later in life. Of course, now with the current trend, maybe children will start taking it. But when these studies are being conducted many years ago, right, they would have been introduced soy at a later time in their life. To elaborate further, I'm not going to bore you with a lot of studies, so I just pick up a few to highlight what I explained earlier. So this study was done by Wu. It's a meta-analysis. That means they pull out a lot of study and then they go through it, and then they find that there's a significant trend of decreasing risk with increasing soya food intake. Okay, if you look at, is there a pointer? No pointer. Oh, there it is. Yeah, there is one. Okay. Yeah, if you look at these two boxes in pink, okay, a lot of words, but bear with me, I'll try to explain as much as I can. So they are comparing these subjects among the 8 studies, right? They compare with the women who eat the highest amount of soya, more than 20 milligrams of isoflavones, compare those who are only taking less than 5 mg. So there is a significant trend showing the reduction risk of breast cancer. So 20 milligram, there's a significant reduced risk compared to the 5 mg intake. And then at the lower part here, they also compare, what about those who are eating moderately, 10 milligrams? Also 10 mg also show a reduced risk of developing breast cancer when you compare to those who are eating less soya isoflavones or soya. Okay, but then when you compare to, what did I do? Okay. When you compare to on the pink boxes, those are all the Asian subjects, Asian women. And on the blue box here, these are on the Western population. So when they are comparing their highest intake versus lower intake, look at the amount. There's only 0.8 mg as compared with our highest intake is 20 mg, 10 mg, but theirs is only 0.8 mg. So that is why another theory is that because the consumption is very different, the amount that is being consumed is very different. So with such little amount, it wouldn't show any protective effect or any risk reduction. Right, and then this is another meta-analysis of 35 studies. Again, this show that the differences among pre- and postmenopausal women in the Asian countries versus Western countries. Again, if you look at the chart here, on the left side, I don't know what I did. On the left side, there's a premenopausal and postmenopausal women. Top part will be the Western women and bottom will be the Asian. Okay, you will see on the chart here that the risks are showing reduction in developing breast cancer for those among the Asian population as compared to the Western. Okay, quickly, because those are conducted in the Western world, but we also want to compare what about studies that are more related to us, that are closer to our homes here. So the top left, you have a study here that is conducted in Malaysia. So it showed among the 7,600 women, and then this is a study done in Singapore, in the Singapore Chinese Health Study, with 35,000 Singapore Chinese women, and some of these two are conducted in China, and also meta-analysis from China, Japan. They also show the same results, that higher soya intake when you compare with those who are not eating as much, there is a reduction risk of developing breast cancer. Okay? So those are observation studies, epidemiological studies. What about clinical studies? Right? You need more proof, right? But admittedly, there are not many clinical studies conducted on soya and breast cancer because it's just too expensive and too time-consuming and it's very complicated to conduct such research. Okay, but we do have one performed in Malaysia by the Cancer Research Malaysia. So they did this, but it was quite close to the COVID-19 pandemic. They finished it, but then they have some of the dropouts. So what it is, because they know that observation studies show high intake and the reduced risk of breast cancer, but they do not see it in the Caucasian or the Western studies, because they only show small or non-significant protective effect. So they did RCT in Malaysia. They had 3 groups taking supplements from soy foods and the control group. So they did this among the Malaysian women. Like I said, because of the dropout, even though they finished, but then the data was not conclusive enough to make a statement about this. But they were nonetheless, they were able to tell that, to suggest that diet rich in soya isoflavones. It shows that diet rich in soy isoflavones is an important and also cost-effective way to prevent or to reduce risk of breast cancer. And that is on reducing the risk. What about on survival, like I mentioned, and also to reduce recurrence? There were also some epidemiological studies. So we have one here on Shanghai breast cancer survival study, more than 5,000 breast cancer survivors. And also at the bottom here, among the studies of US and Chinese women, more than 9,500 breast cancer survivors with invasive breast cancer diagnosis. And then they followed these women for about 4 years and 7.5 years. And they found that there is an improved overall survival and also decreased recurrence rate. And especially among the women who consume soy foods even after diagnosis. Okay, from this study, it showed that women who take more than 10 mg of soya isoflavones per day, when compared to those who are taking less than 4 milligrams, you have a 25% lower risk of breast cancer recurrence. I think that is amazing because people are talking about avoiding soy. But not just that we shouldn't avoid, but we can actually consume it and it help on overall improve survival and also reduce risk. But of course, it has to come with a healthy diet. You cannot just take soy and eating not nutritious food, okay? So when I talk about a lot about milligrams of isoflavones, do we know what that is? How much is that? So basically, in general, studies have shown that 1 gram of soy protein will give you 3.5 milligrams of isoflavone. So what is 1 gram of soy protein? If you take 1 cup of soy milk, because that's what I'm familiar with and that's what's in your bag, that is a 3% protein soya milk. In soya milk, when you find in the market, it can range from 1% to 3 to 3.5%. So read the label, read the nutrition label, that's very important. 3% or 3 grams of soy protein in every 100 ml. So if you take 1 cup, 250 ml, that will give you about 25, 26 milligrams of isoflavones in 1 cup. Okay? So that's about it. That's my final slide. My key takeaways, what I talked about today, I hope you will remember that soy isoflavones is a plant estrogen, and that is not the same as human estrogen, and it does not turn into human estrogen hormone in the body when we take isoflavones. And the role of soya in breast cancer, one, that is strong epidemiological link, that's high soya intake, especially among the Asian population, is able to reduce risk of breast cancer, improve survival, and also decrease risk of recurrence. And especially, there are also a lot of studies coming up looking at when should women start taking soy. Is it pre-menopause, post-menopause, or even earlier? Whether is it during adolescence, puberty, or pre-puberty? Because that actually shows differences. That's when we talk about the Asian and the Western is different because we start eating it earlier. So we definitely need more research to confirm this, right? we need to know, like what I mentioned, how much do we eat to be effective, and in what form, through supplement or through food sources, and the timing of soya exposure. Right, so that's all I have for today. Thank you.
Perfect, on time. Thank you so much. What is the big boss? Question now or question later? Later, okay, good. By the way, in every session there is a boss that no one, always the boss of the session not here, will be there somewhere looking at this. I've organized so many conferences, I know the trick. People think that the chair of the session is no, there is one in the back that is really all the boss. So let me move on to the... So now it's my pleasure to introduce Professor Dr. Tajuddin. She's joining us. She's a dedicated family physician and clinician from the University of Malaya. She has made a significant contribution to tobacco control and public health advocacy in Malaysia. I think we met sometime in WHO or Jordan or somewhere. I mean, your face is very familiar. I don't know. Tobacco control, public health advocacy in Malaysia, community-based intervention targeting youth smoking, which is very important for this year, World No Tobacco Day this year. She leads the national HIBAT program and serves on both national and international committee addressing tobacco use. Her talk will focus on long-term cancer risk reduction through advocacy program, particularly in curbing tobacco use among children and teenagers. Very important talk. Please be this, especially now Malaysia is a National Cancer Society of Malaysia leading the world initiative, Healthy Lung Initiative, and actually that put Malaysia in the World Health Assembly was the star of the region. Thank you so much.
Good morning. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So, my name is Amani. I'm from University Malaya. I'm a family physician. And so I would like to bring you to this notes that was written by several teenagers from several schools that we did programs, mainly advocacy programs. So these notes are written in Malay language. I will help to translate a few for the benefit of everybody. One of it is on the right hand side, kenapa tak tutup kedai vape? So why don't we just shut down the vape shops? Okay, so this is their hope, right? And then, walaupun kerajaan memperlihatkan dan menegas tentang isu vape atau e-cigarette, mengapa isu ini masih berkembang? Adakah kerajaan menggalakkan isu ini dan tidak bertindak? So, why isn't the government taking action? Or is the government actually encouraging the sales of vape in our country, in Malaysia? So, Malaysia is just next to Indonesia. Indonesia is, of course, we know, is #1 in Southeast Asian region for vape use and also sales. Next to them is Malaysia, actually. So this is very heart-wrenching, actually, because the prevalence of vaping among teenagers or even among children is at an increasing rate, right? Okay, so this brings me to the topic today, advocacy programs for long-term cancer prevention and addressing tobacco use among children and teenagers. So I am affiliated to also Nicotine Addiction Research and Collaborating Center under the University Malaya Center for Addiction Sciences. But my department is Department of Primary Care Medicine, University Malaya, and I am also the lead coordinator for HIBAT program. So initially the name HIBAT was actually named GEG, Generational Endgame. It's the taboo word for the industry. So over time, actually some of my students are here today in the hall. The word GEG was actually then creatively turned into HIBAT, which I will tell you later what it means. So this brings me to the table of content, a bit about preventive medicine. So what we are focusing on is prevention, okay? A bit on cessation, what I do in the clinic, of course, smoking cessation. For the children and teenagers at school, we do cessation also for those who volunteer. A bit on burden of disease for Malaysia data, health impact especially on childhood cancer, and also what is Hebat program. Okay, in the Quran, in Surah Al-Baqarah, it says, spend in the cause of Allah and do not let your own hands throw you into destruction by withholding, and do good, for Allah certainly loves the good to us. Now, Hippocrates says, before you heal someone, ask him if he's willing to give up the things that make him sick. So if you see a patient coming to you, and he comes with, for example, symptoms of prolonged cough that you think is COPD, ask them, are you actually willing to quit smoking? Are you actually willing to quit vaping? Because if you do not want to quit smoking or vaping, then what's the purpose of you seeing me in my clinic? Only one thing for symptomatic relief. Okay? Now, according to the Adolescent Health Survey 2022, okay, the burden of smoking and tobacco use among teenagers was 23.3% among male and 6.2% among females. What about current cigarette smokers? It's 10.8% for male and 1.7% among female. So this data is in 2022. From our Hebat data and also our recent Malaysian data, actually, among teenagers, the current prevalence has gone up to more than 15%. So this is worrying. Because you see, there's the overall, okay, 14.9% in 2029 here, okay, so that's about almost 5 to 6%, 0.6% increase. So overall, although you see the number as not so big, but if you actually talk to the teenagers, because you may not get the whole data from that can be representative of the whole Malaysian teenagers, because this data was taken, of course, from 240 schools, covering more than 30,000 of students throughout Malaysia, but some may not reveal. And there are reasons why they do not reveal the reason, whether their status is a smoker, vapor, or whatnot, okay? Or even both. Now, what are we actually aiming for? Okay, so Malaysia is trying to achieve the end game 2040, whereby we are trying to achieve less than 5% of smokers' prevalence by 2040. But is this achievable? By right, by this year in 2025, we were supposed to achieve less than 15% of smokers in this year. But are we there yet? We are far from 15%. Okay, so the generational end game, okay, it was dropped out from the Act 852, the word GEG. So it was replaced with the word minor. So the tactic is that, so of course not by the government, but by the tobacco industry, so that people who reach the age of 18 and above later on are not covered by Act 852, so that they can actually turn into smokers. They can easily buy vapes or cigarettes. So that is why the word GEG was not included in the policy. Right, next. Okay, some childhood cancer and parental smoking. We all know that second-hand smoke or first-hand smoking exposure can increase the risk of cancer for the smokers and also for those who are exposed to smoking. But what are the evidence behind it? Okay, now let's look at acute lymphoblastic leukemia among children. There is an increased risk of childhood ALL, okay, if there is paternal smoking before conception and during the pregnancy. So there's an increased risk for ALL. Okay. What about lung cancer? Because we thought that lung cancer only happens like 20 to 30 years after a person smokes. But if a child or the fetus in utero is actually exposed to paternal smoking, there is a 59% higher lung cancer risk in the offspring. Okay. What about smoking initiation age? Alright, if they start smoking in adulthood, there is a 6-time increased risk of having lung cancer. If they start at adolescent, okay, between 12 to 17, 18 years old, they have 9.6 times higher risk to develop lung cancer. And if they start early in childhood, because there are children who start smoking at the age of 6 years old. A few years back, if I'm not mistaken, it was before COVID, in Indonesia, the youngest smoker found was 3 years old. 3 years older. And he was obese. So they made him stop smoking, but in the process of him stopping smoke, he gained more weight. So he had to undergo rehabilitation. But yes, the youngest age in Indonesia, through reports, was actually 3 years old. Okay, next slide. Now, what about retinoblastoma, eye tumor and brain tumor? There is a positive association for gliomas and also retinoblastoma, particularly bilateral retinoblastoma with maternal smoking in pregnancy. So a mother who smokes in pregnancy, there is a higher risk for bilateral retinoblastoma. Okay, so this brings to why do you actually do advocacy? And when you do advocacy for children, for teenagers, for adults, your target of what you want to tell them would actually differ. Because if you tell children or teenagers about cancer, it may not seem so relevant to them. But with this knowledge that we have today, I think we still have to talk about cancer in them. Okay, especially with the rising prevalence of vape, we are seeing more and more lung problems among teenagers. Okay, especially when they are not able to do sports activities as good as before. Okay, next. Okay, actually I've said this before, but there is also an increased risk of breast cancer if a child or an adolescent actually starts smoking. Okay, so not only lung cancer, but also breast cancer. So it's very important because I think this is a good continuation from your talk just now. You were talking about breast cancer, so it's very important. And breast cancer doesn't only happen to females, but also to males. Right? Okay, next slide. Okay, now, what about tobacco control advocacy programs in Malaysia? What are the objectives? These are just among the objectives, okay? Okay, one is prevention and awareness, right? Number two is, of course, to reduce the morbidities and mortalities in relation to tobacco use, and also to promote cessation. Next slide. Okay, done. Okay, so this is actually a summary of the programs that has been implemented in Malaysia by Ministry of Health of Malaysia. So we have a range of programs from the preschools until adult. So in the preschool, we have program I Am Free. In primary and secondary school, we have Kotak program, which is Kesihatan Oral Tanpa Asap Rokok, which is handled by the Dental Division in MOH. There is also Gegar 18, okay. Gegar 18 is a generational endgame against rokok, I think, for teenagers. And then in higher learning institutions, most of the higher learning institutions in Malaysia are smoke-free. Not all have got smoke-free policy, but most of them have got smoke-free policy. Okay, and well, of course, because I'm from University Malaya, I'm going to talk about Hebat, the training of trainers. And for the public awareness and services, we have Segar Run. They just had a Segar Run a few weeks ago. Smoke-free public areas. So many places in Malaysia are actually designated smoke-free areas. For example, the RNR. Okay, but although when there's Hari Raya, holiday, the Aidilfitri or Aidiladha, when people go to the RNR, we see people smoking right below the no smoking sign. That's what's happening in Malaysia, Dr. Hadi. Okay, so yeah. Yes, there's also a campaign called Speak Out, right? And we teach children and teenagers to speak out in a respectful manner to say no to smoking and vaping, especially when either their seniors say so, asking them to start vaping, or to actually help their parents to quit smoking and vaping. So next slide. So this is just some of the examples of the programs that we did since 2017 until now. We also did during COVID when the PKP, the MCO was uplifted, okay, it was lifted. We go to many schools and we have reached out to almost 8,500 students now. Our team of Hebat team is not so big, there's only 20 of us, most of us are clinicians, but it's a multidisciplinary team. Not only from medical, but we are also a multidisciplinary team from engineering, from the education, especially we have a certified counsellor. We also have a lecturer, no, 3 lecturers actually, from Faculty of Creative Arts. Why do we have people from Faculty of Creative Arts? Is because we've been doing this GEG/Hebat program for the past many years, and we've been doing the same thing. Children and teenagers are very, very creative, so we need to be like steps ahead than them. So we are putting creative arts into our advocacy, whereby they teach them about dramas, about dialogues, how to create movies actually, and short movies, to create awareness and help their peers to not start smoking or vaping, and also to help them to quit through creative arts. So that's what we do. So that's next. That's our logo, Henti Elak Basni Asap Tembakau. Next. Okay, through advocacy, especially when we do training, because it's a 2-level training. So we train our either students or the NGOs through a 1 whole day program. It's an extensive module which we are in the process of publishing it as a guidebook for Hebat. So through this, the students that we have trained either in the university or from the NGOs are given the liberty to actually freely think of activities that they would like to do at schools, because we don't dictate what kind of activities